Hi HR Nation, it's Chris Rainey. Welcome to HR Leaders, the show where we interview today's most successful and innovative HR practitioners 5 days a week. Today we have a special guest. We're joined by Lucien Engelen. Lucien is the founding director of the REshape Center for Innovation and a global strategist for digital health for Deloitte Center for the Edge. Lucien, welcome to the show. How are you?
I'm good. Thank you very much, Chris. And thank you for having me on this bright sunny day at the back end where people are trying to tear apart our roads to repair some of the stuff. So that's also the noise that you might hear at the background.
Well, for the people that do get to watch the video, you've probably got one of the most impressive backgrounds that we've had so far. It honestly looks like an Amazon jungle behind you there. So it's pretty impressive.
I live on the edge of a forest. Thank you.
Which is great, honestly. I'm jealous. I'm in central London, so I'm the complete opposite of where you are. We hardly ever see a tree where we are, which is very depressing.
Yeah, but there are all kinds of other stuff that I do like. So.
Lucien, for people that don't know about yourself and your work, give us a little bit of a background to yourself personally and your journey to where we are today.
Okay. Yeah, would love to. So in 2010, we founded this little small cell that we call the REshape Center at Radboud University Medical Center, which mainly was positioned to get a hold on things that are happening outside that could possibly change the way that we deliver health and healthcare in, let's say, 5, 10, or 25 years from now. And we're basically on the intersection of technology at one end and patient empowerment at the other one. So that's where we've positioned this, and with all kinds of small projects, bigger projects, try to get a hold on that. Also how to change not only the workforce and the workflow, but even also, for instance, the curricula for our med students and biomedical students and nurses, of course, as well. So that's why we've taken that step. Now broadening that also more in a worldwide perspective.
Mm-hmm. So going back a step, what compelled you to pursue a career in healthcare? How did that start? How did you get into this field?
Oh gosh, that's so I'm from a business family, and within our family, which I had to run together with my nephew with great fun and having great times as well. We had automotive companies, we had gas stations, we actually had a funeral company, and also ambulance services.
Wow, everywhere. You're in everything.
We did a lot of things indeed. And so mainly the ambulance services was something that I really was energized by the impact that we could have, and also the funeral services, as you can imagine, as well. And so a couple of years down the road, we decided to sell the automotive organizations, and I pursued from the ambulance services some mergers and acquisitions further down the road, creating dispatch centers, 5 years being the CEO of one of the biggest organizations in the Netherlands for that. I thought it was kind of ready, and you need somebody to, let's say, watch the shop, so to speak.
Yeah.
And I don't think that's my competence. So I ended up at Radboud University Medical Center, where they just had started a big overhaul to bring back the patient back into the equation and more as the center of the target that we had needed. Because as you can imagine, also in an academic setting, you could easily be diluted into just science or just education. And it's the combination of the three of those. And I was asked to come over and help. And that's 10 years ago already. And 7 years ago, we've created from an innovation perspective as a tool to help bring that adventure to life, and having great fun ever since.
Yeah, amazing. So what really occupies your mind then on a day-to-day basis?
For now, maybe also a bit referring to my new book, which is called Augmented Healthcare and the End of the Beginning as a subtitle. I now clearly see how new players get into the market of healthcare, as I can name it a market. It's the Amazons, the Apple.
Google.
Everyone's
getting in it now.
Everybody steps into it, and we as in healthcare tend to neglect that is happening, and think that we are so very special, which we are. But if you drill down everything we do, I think that like 80% of the stuff that we're running is plain logistics. Bringing a patient to the professional, that might be a doctor or a nurse or another staff member or the other way around, or doing that in virtual sense. And then we have this 20%, which is absolute critical and crucial. That's the art of medicine and the art of care. And so from that view seen, you could easily also imagine with a great user interface that, for instance, Apple has with all the stuff that they've created.
Yes.
That blending that a bit also could help tackle the big challenges that we have in terms of sustainable healthcare systems being paid for. We are facing a doubling on healthcare demand. Burnout rates increase in healthcare, so we have to take care of our own people good as well. So the blend of technology at one end with a new model of approach, hopefully, I think could help.
Yeah. And that's one of the reasons I wanted to speak to you is I'm absolutely fascinated by this. Even in the UK now, there's a number of apps where you don't need to go to the doctors and you can do a video call. You know, you can book in a time via your app and they'll give you a call actually at a time that's convenient for you. And, you know, that saved me over the last year or so. That saved me, you know, days and probably, you know, in time rather than having to go to the doctors to do that. And you know, as you know, our listeners are chief HR officers, they're HR leaders from all over the world. And, you know, it's a huge cost to organizations, you know, having people out of the office sick and also people taking time off to go to the doctors, etc. Where in many of the cases, if not, you know, a very large percentage, a lot of these things can be solved via technology. It's not like we're far away. This technology already exists and everyone's walking around with a phone in their pocket that can achieve that as well. So I suppose the key question to kick it off is, I wonder your thoughts are on, you know, how can companies harness IoT to improve their healthcare in their organizations? What are your thoughts around that?
Yeah, I think that's a very valid point. That's also the reason why I think that companies like Amazon, JP Morgan, and Berkshire, as you might notice, on January 30th, announced that they would create their own healthcare systems for their own 1.1 million
I've seen it.
employees.
Yep, definitely.
And I think there's a couple of things to say to that, but I think that the topic that you've touched on in terms of being able to influence the time that people need to spend to have an appointment and go there, and if you would stretch it even a bit further on, you have to take a day off to go to the doctors with your partner. You will burn fossil fuels.
Yep, get in their cars, trains.
Well.
Yep.
We have to build parking garages of $1 million, to name one. While we at the other end know that if only 5% of our outpatient visits would be done virtual, it would save us as a hospital over 200 parking lots a day, Chris. So there is a number of perspectives in that. And by the way, Apple is doing the same. They're also creating clinics for their own people. And I think this is a very huge portion for it, although the American system is a bit different. But we're now starting to see steps towards making it easier, steps to making it virtual. Not for everything, not for everyone, and not always, but it's you as a citizen, it's you as a patient that gets to choose right now. And well, let's be honest. I think, and in my keynotes, I often ask, putting hands up, who has done a video conference with his colleague, friends, or family over the last 2 weeks? And almost everyone raises their hand.
Yeah.
And then I would turn to the next question and said, who has done ever a video consultation with his doctor or nurses? And then people gaze at each other. So the technology is out there. We're used to it in everyday life and in society, but it's not being used within healthcare yet. And this is now changing. In the Netherlands, it's also being reimbursed recently. So that really helps. The certifications and technologies are out there. So that's also why the subtitle of my book is The End of the Beginning, because that's where I think that we're at.
Yes.
It's now getting into loose. Let's be honest, if you or I would order something at Amazon at 11 a.m. and it's not being delivered at 5 p.m., I get grumpy. No.
Even an hour, you know.
Well,
you get the hour delivery in London now. So in London,
you're a Prime member as well.
Yeah, Prime, yeah. So now it's even more ridiculous. So, you know, in an hour's time, you expect that in your office.
Yeah, and then you call for the doctor, and then they would say, "Yeah, that's great. I got it in 2 weeks from now, Monday at 12."
It is about 2 weeks wait in the UK.
Yeah, well, that's
It's average of 2 weeks. Yeah, which is it's crazy.
so that paradigm is shifting, and I do think that one of the great factors could be from an HR perspective to try to help as an employer to make sure that your employees are being able to visit a physician or to get healthcare deliveries, even for instance pharmaceuticals, just to pharmacy stuff as well, to make that as easy as possible. And I do think that if employers would gather and combine, they could be a huge driving force for that as well. And I think also from an economic perspective, there's a great business case in that.
Yeah, there's a huge business case. The cost to companies of people being off sick and obviously taking a day off to go to the doctors is in the, you know, I don't know the numbers, but I'm sure it's absolutely huge. It's something that I hear from a lot of the HR leaders all the time as well. And there is no, they don't see any solution in sight, let's say. And it's also, how do they communicate with their employees when they're off sick as well? So this can also be achieved via technology, video calls, etc. And the current methods and technologies that are in place in large organizations are almost prehistoric in terms of how they run. It's pretty crazy to imagine. And a big conversation in HR right now is really bringing the outside in, the outside experience that we have inside. You made a good example of it. You know, if in a business, if you were to order a stapler, let's say, it would you'd have to go through an approval process. You'd have to get the budget signed off, and then you have to wait 3 weeks to get that. You know, outside, you order it on Amazon, it's there in an hour. So we really need to start bringing the outside experience of people inside the business and adopt those technologies.
You don't have to type anymore, Chris.
Yeah.
Shout to your Amazon Echo or your Google
You
Home.
took my next point. Exactly. I literally had it written on my paper right here. You know, voice, Alexa, Google Assistant, HomePod. We have to start harnessing. So what is the barrier then? Because it seems that externally people are ready. You know, we've already embraced it. Why are businesses lagging so far behind? And healthcare systems, let's say, sorry.
Well, yeah. Well, I think it's not specific to healthcare indeed. So it's more like businesses in general.
Mm-hmm.
You know, the interesting thing that I've seen, and for this is in healthcare, is that whenever there's a new intervention invented for a medical procedure, it gets adopted within a blink of an eye. If somebody announces this in Australia by video, people will start using that this afternoon, let's be honest. Mm-hmm. But that is not about our own work processes. That's not about us changing. It's about changing something for somebody else. So whenever it touches your own job or workflow, it also gives a kind of an insecurity feeling that goes with it.
Sure.
How is this going to affect my job?
Mm-hmm.
Is it going to affect my job? Is it that I'm becoming obsolete in the end of the day or not?
Yep.
So nothing human is strange for us people, which is good, and also within a work setting. But I do think that what we see right now is that people are getting used to it in everyday society and then starting to change. And one of the polls that I have out there for a couple of months already is me asking, where do you think that healthcare will be delivered in 10 years from now? And if you would ask that to patients or non-healthcare professionals, they would say, well, I think it's like 2% by the doctors, 10% in the hospital, 20% at people's homes, and the rest, like 70% everywhere. If you would ask the same question to healthcare professionals, it's the other way around.
All in the hospital, or all in the doctor, all in.
So it has something to do with the perspective that we have. And I think this is common. We need a gradual approach, but, and that there is a but, it's we've known this for a couple of years. And in my keynote last weekend in Barcelona, I said, I think playing time is over. It's not something that is going to come into your village or in your street. It's in your kitchen already.
Yeah.
The kitchen is burning and you're kind of cleaning your front porch. And that's still a notion that is kind of lacking. People tend to think, well, it takes a while, but all of a sudden it's at your breakfast table.
Yeah. It's the same with every industry. Everyone's going through that digital transformation right now.
Sure.
You see it across all sectors, right? Healthcare is just one of them. And you're right. The biggest, when I speak to all the HR leaders who are leading this transformation, right, the cultural impact, because people don't like change, right? It is the human resistance and the fear of, losing their job. And that's really the hardest barrier to overcome in all of this, right? So it's going to take a lot of time. And it's really also about supporting those people too. The people in the healthcare system, the doctors, etc. It's a big change for them. Everything they've known and been taught and been doing for many, many, many years is now being almost flipped on its head. So I can imagine it's definitely not going to be an overnight change.
No, it's not. The interesting thing, Chris, in this is that, and again, let me talk about our own situation within healthcare. A lot of people think that this is about technology, or that this is about processes. It's none of those. It's about culture. Because the problem is that we approach these kind of changes from a technological perspective. Like, hey guys, now we got this piece of technology and now all of a sudden you can do things in another way. And we will buy that technology, or we'll change the buildings like we've done with the University Medical Hospital. It's the biggest real estate overhaul ever that we've run. And we actually accounted for a huge change program for the next 5 years and allocated budget for it. In the end of the day, it's being poured into bricks and in bytes again. And still not about the change management that my colleagues need whenever they step into that new building, needing a whole new process and a new approach, and changing their ways of work massively.
Yeah.
And we tend to think, well, let them figure that out.
No, that's the most important part. Everything else fails if that doesn't. There's so many organizations I speak to that come up with this amazing strategy, they implement it, and they forget about the cultural impact and supporting people through that process. And of course, you're going to get your early adopters that are really excited about it. You're going to get people in the middle that are on the edge, and then people that you just may never be able to convince. And that's going to happen with any change, unfortunately.
So I think that this is a very important aspect that the boards and also HR executives should emphasize on, because technological opportunities are huge and there's almost no barrier to use whatever kind of technology. And sure enough, there's discussions and debate about privacy and ethical debates, but we all know that they will be solved at one point in time. That's not the issue. The real issue is, how will you help your colleagues to adapt to that new normal, because that is what is going to happen. And to be honest, and I don't think that's exclusively for healthcare.
That's for everything.
Very low uptake on that perspective. Why do we have chief information officers? Why do we have chief estate officers? Where is the chief culture officer? Just to name one. And certainly for the next couple of years, we really have to emphasize on that, because the change is massively.
Yeah, I completely agree with you. And I think this is where HR can have the biggest impact within the organization, right? So you mentioned privacy, because this is something which has been brought up to me a lot, and it's a controversial topic, healthcare data, particularly now where I'm not going to name the organizations, but there are many companies that have launched apps for their employees to help track their health. And of course, they're collecting all of the data. And I know a lot of people, I've read a lot that people are concerned about that. Great that, their organization's supporting them, in their health. But, what if there's a new promotion that comes up and I'm less healthy than the colleague next to me who's also going for the same job? These are legitimate concerns that people are having. So there are many organizations, I know a few that, have over 100,000 of their employees on their healthcare app. And they're collecting this data themselves. What are your thoughts on that, on the the privacy side, and how can this impact companies?
Well, so let me start by, I think there's a great opportunity to make sure that you as a citizen or as an employee have more information about your health. I think that's good. We are running a program internally, which is called Healthy Professional, where we also collect some of the data. And this is bringing Notion back to me also as an employee and my colleagues about how I'm doing. So if my employer could help me in that, I really would welcome that.
Mhm.
Technology is bringing in opportunities for that, where, for instance, employers could say, well, hey, maybe that's a good idea to give somebody a watch or offer a app to collect those kind of things. The thing you have to be very damn sure about is that you are very explicit in what you are collecting, why you are collecting it, and what you are going to do with it.
Mhm.
So we now live, it's now June 1st, we now live in a post-May 25th era where the GDPR has come to
Yes.
life,
Yep.
where the majority of the legislation framework that goes with it is being placed. So now every employee could ask his employer to say, what kind of data do you have from me? What did you do with it? What are you going to do with it? So from a framework perspective, that's in position. So that also gives you as an employee the opportunity to start that debate, because I think you should start the debate, the discussion about this, because obviously we will all, employees and employers, start to explore the boundaries of it.
Mhm.
And you and I know, and I think all of your listeners know, there were crooks in the Middle Ages and there will be crooks in the future. So some of us as in employees and some of us as in employers will take the wrong pathway. And that's a trajectory that we'll have to face. That's with every new opportunity that in the end kind of scopes the setting into it.
Yeah.
So now back to the stuff in terms of promotion aspects of that. I think that has been of all ages. The interesting thing now is that often you don't know based on what kind of principles you are going to be promoted
Yeah.
or being surpassed. So interesting enough, if this is one of those, you could argue and debate with that. And let's be honest, we've also seen this with women that became pregnant in
Yes.
early days. That was and still is something that is taken into an account, and luckily that is no longer an issue. And we've kind of created also the framework surrounding it. And I think this will be the same.
Mm.
On the other hand, is knowing what's being collected and what's being done with it, in which context it is able to being used, and that's the GDPR.
Yeah.
I think it's a blessing in disguise.
No, I'm with you. I completely agree, because in the
So let me
past,
add one thing to that. From a health perspective, a lot of people have worries about what Apple is doing and what Google is doing and Amazon is doing, and obviously also about Facebook. The other thing is that these companies, as of May 25th, are ready for it. And the majority of the healthcare organizations are still not. It'll take us a year and a half or two.
It's crazy to think that.
Because if they wouldn't be ready, they would go black. So that's the other thing. So it is something that is in place already. We have to deal with it. Our take always has been, if somebody talks at a table about us and we're not at the table, we're on the menu. So we decided to join that table and said, if we're at that table, we're able to steer and to guide it also from an ethical perspective in the right direction that we think. Not being at that table, just sitting back and wait what happens and then say, well, that's not good enough or we're against it. I don't think that's the right way to approach it. We have to deal with it also in a co-creation fashion, I think.
Mm. What are the, why are companies like Apple, Amazon, Google able to move so quickly? What barriers don't they have that perhaps public sector does have, that's getting in the way of them being able to move at that type of speed? Because these organizations are still huge. I'm not saying they're as large as a country, but they're huge organizations as well, right? It's a big shift. So what are the main barriers then for us making this common practice where we use technology to communicate with healthcare professionals?
So I think the first thing to state in that is that they are based on consumerism. So you as a consumer get to choose whether or not to use it. It's you that decides whether or not to
I'm
buy
with
an
you.
Apple
It's
or an
true.
Amazon
Yeah.
or a Samsung smartphone. So that's one. And that's a market of N is one each and every time. And as an employer, we want to make sure that we do stuff that is good for in our case, are 15,000 people that work within Radboud, for instance. So there's also a trade-off in that. We have to make a package that fits almost everyone. Maybe we get to have one or two choices in it, but that's it. So if you have the opportunity to choose yourself, that's also a way, if the value proposition is good enough, like in the technology and the money that needs for it and what it actually is doing for you. That's the reason why these guys can act so fast. What I like about their model is that if we would able, and again to healthcare, if we would able to use that, let's call it for now, psychological warfare, to make me anxious that I don't have the latest iPhone.
Yes, yeah.
Use that perspective and framework for people with diabetes or whatever kind of condition to stick to the treatment that we've agreed and to adhere to the medication. I think that could be massively. So that's why we're looking also into that. So they have, they can decide by their own. They are being guided by market principles. They have more cash than I think than the majority of the countries out there. And after these other markets like travel and music and media, they're now up to that new market for them, healthcare, where at one point in our life, you and I will be facing healthcare as opposed to the other ones, which will be markets of choice. Some people read, some people travel, not everyone. Everyone at one point in time gets to face healthcare, and it's a market that we use on a daily basis where new people get born and sadly others pass away.
Yeah.
So to me, it's not a question if that is going to happen, it's when and how. We've seen it happen, like I said, with Amazon, and I think a lot of people were kind of not worried, but confused when Amazon bought Whole Foods in the US. 550 brick and mortar stores, and everybody said, why is the king of online retail?
Yeah, well, it makes no sense on paper, did it?
It did not. And then 6 months after, they've announced they are steaming up for their 1.1 million employees. And now all of a sudden, you can imagine having nurses staffed with all kinds of fun technology stepping into these mini clinics that are embedded within those supermarkets, starting to deliver lifestyle advice, wellness, and then pharmacist services, and gradually also medical interventions.
Sure same with Walmart, right? Is that the same? They're doing the same thing?
Yeah, I think Walmart
opening up
in that sphere for a number of years. The way that they've done it up until now is they would partner with local clinics.
Oh, okay.
Like square feet, like number of this. Just come on in and we'll give you a sub office of your, it's mainly a outpatient clinic or something like that. And the difference is that JP Morgan, Berkshire, and Amazon have said, no, we are going to deliver those services ourselves. So
end to end, everything.
Yeah. And they want to overhaul the whole system, and they want to get knowledge of it. And let's face it, with all the number of people that buys with Amazon, imagine that they would create a healthcare insurance program.
I know. It just blows my mind.
As part of your Prime membership.
As part of your Prime. Yeah, it's scary now, right? You remember them as a company just doing books, and now and now they're just everywhere and everything you can possibly think of.
Actually, Alibaba, their competitor, is offering free healthcare insurance services. From every amount that you buy with them, you're safe a bit of for premium for your healthcare insurance.
Really?
That's happening already. So
wow, I didn't see that.
Well, that's why I said it's in your kitchen already.
It's already there, yeah. I thought, I didn't realize it was that far down the line. I didn't realize they were offering solutions like that, but it makes perfect sense. Is there legislation that, Amazon has to adhere to do this? Because surely, because they know they immediately over, in the space of a few years, they could literally, dominate the entire marketplace. Anything stopping them from doing any legislation or, there must be something in place, surely.
Yeah. So I think there's not only European legislation, but also others, of course, that they have to adhere to. So that's one. However, like every insurance organization that you would like to create, there is obviously all kinds of financials and all kinds of other stuff that you have to adhere to. The other thing is that if you as a person, you as a citizen, or me as a patient, are able to choose whether or not I would buy an app for $9.95, where I could talk 24/7 to a Dutch-speaking physician, maybe in Australia or in central London or in Canada, that's my choice.
Mm.
And the question is, and that's an interesting thing, how this digital market, I think the digital market is global. And whenever I have this credit card, I can buy stuff in the US, and I bought today stuff in India, and I had to buy a plugin for my website that I bought in Bangladesh, and I visited also the US today to buy something. So that is changing. And legislation, I think, always will follow practice. I've never been able to catch whatever government to be preluding on the market. It's always afterwards.
Yeah.
And so we have to adhere to that.
So you think that will really help push it once these companies become established?
I'm sure.
Yeah, okay.
I'm sure. And just imagine that, and again, a bit more from an HR perspective, one of the groups that we're collaborating with is creating what we like to call a digital human, which is a chatbot, but then more in a graphical way. And I'm doing them disservice to naming them a chatbot, but just for the interest of the discussions, with artificial intelligence just underneath it. And I'm able to talk to them as if I would talk to you, Chris.
Yeah.
And if there wouldn't be a sign on top of it that this is a digital human,
you wouldn't know.
No longer know that that's the case. They have emotional recognition. They completely understand what I'm saying. And one of the things that we're now trying to do in a GP practice, just for instance, and we can easily translate that to HR, 75% of all the patients of a regular GP is not visiting them once a year. So you would never see them that year. So just imagine that digital human could visit once a year as the assistant of Dr. Engelen, just assuming that, and say, hey, I'm the assistant of Dr. Engelen, just chiming in, want to know whether or not it's good with you. I got a couple of questions. Meanwhile, they record my voice, in which they can discover that tremor that is a pre-recognition of me maybe getting Parkinson's or stuff like that. That's the same also from an HR perspective. If you would be able to do these kind of things and have your reviews also being done digital for those.
They're already doing it now.
We see
slowly.
interviews.
Slowly, like we had a live show on Wednesday, and it was about chatbots for HR. That was exactly AI. And whenever you say chatbot, it doesn't do it disservice.
It is.
You're right,
absolutely.
you know. Yeah. And the company in particular that I was working with, they have a very advanced AI integration into that, which makes it absolutely incredible. It's more for the recruitment process. So it will just, it was incredible. And, the data, for example, that doctor who can visit once a year, it already has all of that data on you as well, right? It's already stored. It can already access all of that. So it's fantastic.
There's a great company in New Zealand that's called Soul Machines that has created an awesome digital human that already is being used by 10,000 people living assisted in their own homes in New Zealand. You can apply for a credit card completely via that system. And
really,
that you kind of look worried, even lying, and all of a sudden they just patch you through with a real human. You can imagine how this really works.
That's amazing.
So my point here is that if we were able to patients or employees to give them choice, because sometimes you really would like to talk to a real person.
Yeah.
But some of the times you would say, well, no, I'm fine doing that early in the morning or late night and just do that round of review or whatever, and then send that off after I've confirmed and given consent for it.
Yeah.
And in 2 weeks from now, I really want to talk to a person and sitting next to him with a cup of coffee because I need the time for that.
Yeah. What are your thoughts on something I've been doing a lot of research on recently? What do you feel the impact of blockchain will have on healthcare?
Oh, that's a good question.
It's a big question, though.
Yeah. So we've run a huge blockchain project in 2016 together with SNS Bank and Deloittes. That was so way before that I joined them. And what we've done is that we created a medication file on the blockchain that you could access with your banking card and your random reader, because that's one of my dreams. Why in the world are we creating all kinds of different login systems and security systems when in the Netherlands, 93% of all people are using their banking card and their random reader or an app for that on a daily basis? So why create something different? So what we've sensed back then, so 2016, not so long ago, it was too early. People did not really understand what the blockchain was. It was more like a confused kind of thing with the Bitcoin, and they thought it was one of the thing. And so we decided to put it on hold for a couple of months / now a year and a half. And I think we're on the brink of resuscitating that project again. So back to your question, I think blockchain or blockchain kind of technologies are very promising for healthcare and also all kinds of trusted communications that we need, which is also the case in HR, of course. However, I also think that it's very immature still. There's great promises, great projects. It's not scalable enough if I listen to all the experts on it at present. And I also could imagine that this is the early phase of it and that in 1 or 2 years we would have different kind of blockchain kind of technologies that might be even better or have a different perspective in it. We need a new trust layer. That's And if that would be the blockchain or something like it, I don't know. It's the same also in healthcare with all those new technologies out there from apps and portals and EHRs and PHRs and virtual reality and artificial intelligence and God knows what we have more. The quest will be, who will I trust? And I think that although a lot of people argue that the general practitioner, the GP or family physician is going to be disrupted, I think that their current role is massively going to be disrupted. But if they play it right, they can play that new role where they would be the trusted advisor of the patient, having that holistic overview of everything that happens. Back to HR, I think that that is the same within organizations. That in the end of the day, bringing all those things together, if played right, again, I think that's the condition that you need. That could be the new roles.
Very interesting. And I was just thinking while you were saying that for the healthcare practitioner as well, do you think, many of the future of work's hugely changed? You've got people a lot of people working freelance now, and it's becoming more and more now. You've got companies like Upwork and Exist. Would you think that would be the same with healthcare? Do you think you have doctors that would never actually step foot in a hospital and just work from home? Doing these video calls and advising people, doing subscriptions, etc., all from the comfort of their own home or wherever they are in the world. Is that a future that you see?
Well, that's happening right now. I think that one of the good examples and one of the early, and maybe the earliest example is Jay Parkinson, who is a GP in San Francisco, and his outillage is his car, his doctor's bag, and his cell phone. And you can book an appointment with the guy, and he just drives up to your home or your work or wherever you are, and everything that a GP can do remotely, he can do. And you now see all kinds of services and apps coming up for those kind of things.
Uber of GP of Ubers of GP.
And exactly.
So you just order a GP via like an Uber.
We've got Uber Health already, where you could, for your annual flu vaccination, you could order a GP or a nurse in a Uber cab, and they would charge you $19.
Really?
Absolutely. This is running every year already in the US. The thing is that if I would say at my workplace that, hey, I've ordered a Uber for Health and somebody's going to vaccinate me for $19, I know that some of my colleagues would say, hey, so I don't have to go to my GP for that? Bring him in. And then
100%. Yeah, I didn't even know about that. So
that's happening. It's, I think, for 2 years already. So what you will see happening is that there will be a tendency of some physicians and professionals to take that challenge, and that's fine. Others never would like to do that, and that's fine as well, because we need both. We now need I often talk about a cafeteria model where you as a citizen or a patient get to choose.
Yeah.
Now there's a choice of one, namely take a day off, go to your physician, and then go back. And
yeah, it would be much more effective for companies to be able to bring in a doctor into their office. Even if they did it once a week, it would be much more cost effective for them to do that than actually have people off sick, going to doctors, et cetera, et cetera.
That's a great point. So it's 2018, and I still don't get why huge corporates haven't found a way to hire an independent physician and
why not?
give them an office in their huge building, which is like 30 stories high, and they got a Starbucks in it, and they got a grocery store in it.
They ain't got a doctor in it.
You can bring your clothing, cleaning services. Why not bring in for at least once a week?
Yeah, at least.
And I haven't figured out why that's not happening.
Well, I'm going to ask that question to everyone on LinkedIn now, because that's a very good one. Well, look, that leads us quite nicely onto what we call a quick fire round, where I'm going to ask you 5 questions, and you have no longer than 30 seconds to give us some amazing answers. Are you ready?
Oh, let's go. Sure.
What was the number one thing that was holding you back when you started the ReShape Center of Innovation?
Time allocating for it. It was not about the mission. It was not about whether we would succeed. It was more like, can we get the time for it? And we needed a board approval, which we had in an instant, to be honest, at the end of it.
Okay. What was the best piece of business advice that you've ever received?
2 letters. Do. Or maybe 4. Do it. It's more like
stop talking about it and do it.
No, that's also my motto. Stop talking, start doing. You can talk for ages, but it's not going to get a better advice. You cannot learn riding a bike from a book. You only can learn it from just doing it.
And I was going to ask you, what's the book that you'd recommend? Tell us a little bit more about the book and what people can expect from the book. The name of the book you've just
my own book.
Yeah,
okay.
exactly. Yeah.
So my own book is Augmented Health, and the subtitle is The End of the Beginning, where I describe what has been happening in healthcare over the last 7 years in terms of this shift, which is now turning into a digital transformation, where data from the professional side, from the medical side, a care side, and lifestyle data is merged into a layer that gives us a way to have better decisions. Secondly, the book is about everything that's happening now and changing your roles as a employer and employee in healthcare organizations. Your job as a nurse or as a staff member or a physician massively is going to change. So the book is also about the new players like the Apples and the Googles and the things that we talked about. It's not a manual. It's more like an overview with all kinds of vignettes in it. And people have been asking a lot about that. So in the end, I've been able to write that down.
Here, like, rather than asking everyone's question, let me just write a book.
Well, go out to Amazon, go out to Apple. It's out there already.
Perfect. I'll link it all in the description for everyone to have. Could you share, there's so many different online resources about this area now. What are some of the top online resources that you would recommend, websites or apps for our listeners to check out?
For the change or about healthcare?
Both, really.
So let me take you guys a bit out of your comfort zone. Go to singularityhub.org, where there's on daily news about all new technology that's coming up, maybe in 5, 10, or 25 years from now, but that will give you a lens on what's coming up. And I think we need those lenses to just see what's happening. And there is a law which is called Amara's law that states that we overestimate the speed that things are hitting our breakfast table. We underestimate the impact of it. So those two combined will give you a lens on what you've been doing in your role as an employee or entrepreneur or CEO of an organization in 15 years from now.
Fantastic. And for yourself, what's the one thing that you're most excited about your business or your organization?
I think, so we know that healthcare is an unsustainable model as we have it right now. It's going to double in demand and we won't get more money. And I think we get less. So this time right now brings us for the very first time the opportunity to be able and present when somebody gets sick or to prevent that somebody gets sick. 90% of all the budget in healthcare goes into fixing stuff. Now with all the technology, we can hopefully prevent things to occur and saving people out of life events. And that's what I'm excited about the most. If we also could combine that with having a sustainable model for our colleagues, burnout rate is going through the roof in healthcare, not only for physicians, also for nurses, also for staff members. So being able to bringing that into play, I really hope that that really helps some bring some progression.
Fantastic. Well, what a great purpose to have, right? That's just incredible. Well, thank you very much, Lucien. I really appreciate you taking the time to join us. Absolutely fascinating, and also some great advice for the listeners as well. So I'm really excited to share this with them. Before we wrap things up, give our listeners, if there's one parting piece of guidance you could give, what would that be? And also, what's the best way for us to learn more about you and get in contact if our listeners wish to do so?
So first of all, again, thank you for giving me the opportunity to share some of these insights. I think there's a great resemblance between HR and what's happening in healthcare. It's all about people.
Yep.
Which is great. The best advice is what I already have given. Quit talking about stuff. Just go in there, create a safe environment in your organization to explore things. And from that, really take steps in that perspective. If you want to learn more about that, my LinkedIn blog is open for that. I'm on Twitter at Lucien Engelen, and my website, lucienengelen.com, also gives great insights of things that I care about.
Fantastic. Well, thank you again, Lucien. Guys, make sure you head over to hrleaders.com. There you'll find all of the show notes on the episode, everything that's mentioned, all of the links will be included in the episode. Lucien, thank you again for taking the time to join us, and I wish you all the best. Until next week.
Thank you very much, Chris.